takes the blood away. So for example, the splenic artery delivers blood to the spleen, and the splenic vein drains that organ. So just one artery feeds that organ, and one vein removes blood from that organ. That would be a simple or end artery pathway. An alternate pathway are configured a little bit differently. Think more than one artery delivers blood to that area, or more than one vein takes blood away from that area. The first, arterial anastomosis, is where arteries join together. Two or more arteries converge to supply the same region with blood. So an example, in your abdominal wall, the epigastric region, we have the superior and the inferior epigastric arteries feeding your abdominal region. So the arteries converge to feed that one specific area. Venous anastomosis, where veins converge, is more common. Two or more veins leave a body region and drain it. So the upper limb is drained by the basalic, the brachial, and the cephalic veins. Brings blood low in oxygen from those parts of the body back towards the right atrium. And then, even cooler yet, you have these things called shunts, with a very fancy name. Arteriovenosus anastomies. I'm not saying that right. Okay? It delivers blood directly from an artery to a vein. Artery to vein without capillaries in the middle. So it shunts the blood, bypasses the capillaries. We have these in our fingers, our toes, our palms, and our ears. So, if your body needs to conserve blood, conserve heat, and get it moving quickly to where it's really needed, it will shunt the blood away from those areas quickly. Now let's think about these areas. If it's really cold, what are the first areas in your body that are at risk for being hypothermic or get frostbite in? Fingers and ears. And it's for this reason, because of the shunts. That's amazing. So here is the pathway, simple pathway. The anastomies, or essentially converging. Here's converging arteries. Here's converging veins, or diverging, I guess, but there's more than one vein leaving that area. And then here's the shunt, where it can bypass capillary beds in times of need, when your body different organs need the blood more than your ears. Next, we are going to talk about a few other specific things with blood vessels and blood flow. So if we were to look at the cross-sectional of blood vessels, so we're looking at the cross-section, we're looking at the diameter of the lumen, and we're going to compare diameters of all the arteries to all the capillaries to all the veins. So a total cross-sectional area, if we took all the arteries in your body, measured their lumens, and added them all up together, same with capillaries, and same with veins, that would be the total cross-sectional area of all of those. Okay? You with me? The biggest cross-sectional area would be in the capillaries. Not because their lumen's the biggest, because it's not, but there's a lot more of them. So if we add them all up, there's going to be more space. Velocity is how fast the blood is moving through. Blood flow velocity is inversely related to total cross-sectional area. Blood flow velocity is inversely. So if one goes up, the other goes down. So if blood flow is slow in the capillaries, that means there is more area or more cross-sectional space. Here's a nice graph. Cross-sectional area is in blue, and blood flow velocity is in red. So down here in capillaries, let's look at capillaries, they're right in the middle. They have the most cross-sectional area, but look at their blood flow velocity. Hardly moving at all. Let's compare that to arteries, elastic arteries. Look how fast the blood is moving through there. And look how low cross-sectional area is, okay? So why is the blood crawling along at a low speed in the capillaries? Because your cells in your body need the oxygen that the capillaries hold. So it wants to make sure that that adequately happens. So the blood velocity chills. The blood's like, okay, we need to make sure all the oxygen leaves, and we need to get all the waste back in. So you slow down to speed up, essentially. Okay. Lastly here, we're going to continue to talk about the movement of materials in and out of the blood vessels, but just in more detail. We're going to talk about pressures and diffusion and osmosis, wonderful things. So this is some concepts we're going to touch on or review. So diffusion is the movement of particles from an area of high concentration to an area of low concentration. That is diffusion. So we're talking movement of oxygen, hormones, nutrients, carbon dioxide, waste. Okay? Which way particles move from outside the blood to inside the blood, or from inside the blood to outside the blood, depends on concentration. More out here than inside, it's going to diffuse down. More inside compared to outside, it'll move out. Also, the size of the particles makes a difference. Smaller solutes, like gases, can go through easily through those cells, those endothelial cells of the capillaries. But larger solutes have a little bit of harder time, so that's why in the capillaries that have the holes, the fenestrated capillaries and the sinusoids, that's where those are going to diffuse across. When we get into the equations here, we're talking about bulk flow. Bulk flow is a term used to describe the movement of fluid from outside the blood vessels to inside, or vice versa, but this fluid holds particles that you need. So, bulk flow is the movement of fluids and their dissolved substances within them moving. Whether something moves from outside the blood to inside or from inside to outside has to do with pressure. Net pressure is total pressure of two opposing forces. Here are the two opposing forces: hydrostatic pressure and colloid pressure. Okay, remember that, we'll come back to it. So, here's our blood vessel. Okay, here's our arteries coming in, and here's our veins leaving it. This is the arterial end, this is the venous end. Okay, something called filtration happens on this end, and reabsorption happens on this end. In filtration, substances move out of the blood. Out of the blood, because this is my blood in my hand. In reabsorption, fluid moves back into the blood. Out of the blood at the arterial end, filtration, into the blood at the venous end, called reabsorption. I'm going to show you that picture here. So, filtration, arterial end, out of the blood. Reabsorption, venous end, into the blood. The first pressure is called hydrostatic pressure. Hydro, water. So it's the force exerted by a fluid. This is blood pressure. So the blood is within the blood vessels. It's the pressure that the blood puts on the vessels around it. There are two types of hydrostatic pressure. Hydrostatic blood pressure, like I just mentioned, the pressure of the blood on the wall, And then there's the pressure of interstitial fluid, or the fluid around the blood vessel. The good news is we don't really take into consideration interstitial fluid pressure because it's close to zero. The other type of pressure, besides hydrostatic, is called colloid pressure. You have these solute particles inside the blood and outside the blood. And think of osmosis. When water moves from one side to the other, it's because one side is more salty. So colloid osmotic pressure is the pull of water into something due to the presence of proteins that are within it. I like to think of it as salt, but it's proteins. Like albumin is like an egg white protein. Let's look at the picture because I like the picture better. And you can read this in your textbook, which you'll want to, and pause, look at the numbers, make sure you understand it. But I'm just going to go here because it says it all in picture form right here as well. So here is our arterial end. We see there's bulk flow out of the arterial end. Why? Well, we have to take our net hydrostatic pressure. So the pressure of the blood pressure is 35 millimeters of mercury on the arterial end. The interstitial fluid pressure is 0, so 35 minus 0 is 35. And then we have to minus the interstitial osmotic pressure from the blood osmotic pressure. So 26 minus 5 equals 21. Then we have to calculate the net filtration pressure. You take the colloid, you subtract it from the hydrostatic, and you get 14. So your net is 14 millimeters of mercury blood pressure wins. So blood pressure is going to push fluids out. On the other end, the big difference is everything is the same. You can see over here it's 21, but blood pressure in the veins is substantially less. It's 16 rather than 35. So when we do the math, we get actually -5. -5 means there's less pressure within here, so substances will bulk flow back into the veins. Lastly, the lymphatic system. So you have fluid moving into the blood vessels and out into the fluid around it called the interstitial fluid, and fluid moving from the interstitial fluid back into the blood. And that's constantly happening. But there's 15% of the fluid that is not reabsorbed back in the venous area. 15%. So 15% of the fluid that goes out doesn't come back in. Where does it go? Well, also next to the blood vessels, you have lymphatic vessels that reabsorb that tissue, or not tissue, fluid, so you don't have fluid accumulate into your body. So that's awesome as well. Okay, we're almost done. Okay, so a few other terms with blood flow. So not all capillaries in your body are filled at the same time. The local blood flow to specific areas can vary. It can be measured in milliliters per minute, and it must be high enough to maintain adequate perfusion, or getting the tissues in your body the oxygen. A few things affect how well your tissues receive blood, or how well they're perfused. How vascular you are, or how much blood vessels you have. Something called the myogenic response. Other factors, local factors, and then total blood flow. So the first, the degree of vascularization. So that's the